Hello everyone, my name is Alex and I'm a research facilitator and part of the Raptor C19 study team. Thank you so much for your interest in the study. In today's video, I'm going to be walking you through an overview of the study and what you can expect as a participating practice. Raptor C19 is a research study that aims to assess the accuracy of different rapid tests for COVID-19 for patients in the community. Our question is whether rapid tests, which give results within minutes or hours, are as accurate as standard laboratory tests. We're doing this by performing both point-of-care tests alongside the Public Health England standard tests within GP surgeries around the country. As a participating GP practice, you will be identifying eligible patients, consenting them, and performing both the point-of-care and PHE reference tests. The PHE reference tests are a nose and throat swab looking for current infection and a blood sample looking for COVID-19 antibodies. The point-of-care tests will vary from site to site and may use a range of biological materials including nasal swabs, bloods or saliva. All practices will be provided with the supplies required to carry out these tests and will be paid per patient enrolled into the study. The first thing to do is to check your practice is eligible. In order to take part in Raptor, we firstly ask that you are a member of the Royal College of General Practitioners Research Surveillance Centre. This is not to be confused with the RCGP Research Ready accreditation. We also ask that you are willing to see symptomatic COVID-19 patients at your site, as we're asking all participants to be willing to test for both past and present infection. Finally, we ask you to ensure that you have the facilities at your practice to be able to perform blood tests, as these are required for all adult patients enrolled into the study. Once you have been selected to take part in the study, you will be asked to sign an agreement with Oxford University and our ECRF provider UMed. We will also ask you a few questions around the operational model of your practice in order for both the study team and the CRN to provide the best support possible. This study has a dedicated email address with the team on hand to answer any questions you may have, so you'll be fully supported at all points of the study. On the screen now, you will see a full list of all the documentation that you must provide to the study team ahead of commencing recruitment. We also ask that you ensure that you have received all the supplies, as the delivery dates may be slightly staggered for the various pieces of kit. Once all deliveries have been made, your practice should have the following: a box Samsung tablet, the reference PHE virology kit, which is the longer box you can now see on your screen, the reference PHE serology kit, which is the square box you can now see on your screen, and the point-of-care tests. As previously stated, the point-of-care test will vary from practice to practice, but for the demonstration here, I'm showing an SD biosensor lateral flow test. All the point-of-care tests will come with their own implements for sample collection, such as swabs. Please take care to never mix supplies across the various kits. The two reference tests have different forms and the pre-addressed envelopes go to different labs, so any mix-ups may result in your samples not being processed. So once you're ready to start recruiting, simply do the following steps. Please note all videos are for illustration purposes purely, and you should always use appropriate PPE when dealing with patients. Step 1. Identify eligible patients. This can be done both opportunistically and by searching patient records. Please check our website for the most up-to-date eligibility criteria for the point-of-care test being used at your practice. Step 2. Add the patient onto the UMed platform and run through the consent form. For further details on how to do this, please see our full UMed training guide linked on our website. You will then go through the ECRF with the patient, collecting information from them such as their vitals, current symptoms, and the results of any previous COVID tests that they may have had. Step 3. Complete the point-of-care test or tests on the patient and record the result on the UMed platform. In some cases, the test may take up to an hour to provide a result. If this is the case, we would encourage you to carry out the subsequent steps, and once the appropriate amount of time has elapsed, record the result. Full training is provided for each point-of-care test used within the study. Please see our website for detailed instructions on how to use the devices that have been given to your practice. For demonstration purposes, here I am using the SD biosensor lateral flow test. Step 4. Carry out the virological reference test and record this on the UMed platform. Please also make sure that you complete the E4 form in full. Once the test has been completed, please place all the components, including the E4 form, back in the box and place in the pre-addressed envelope for the PHE Colindale lab. This sample can now be posted using a priority post box or any alternative methods that you have arranged with the study team. If the patient is under the age of 16, these are the only tests that need to be carried out and the patient's participation in the study is now complete. Step 5. If the patient is 16 or over, carry out the serological reference test and record this on the UMed platform. Then complete the Raptor C19 serology form in full, including the unique Raptor ID that can be found at the top of the patient's consent form. Once again, please place all the components and the lab form back into the box and place into the pre-addressed envelope for the PHE Manchester lab. This sample should now be posted using a priority post box. Please note that practices are paid per complete sample, and therefore please make sure that all forms are labelled and packaged correctly. For further information on how to carry out the reference tests, please visit the RSC or PHE website. Step 6. Arrange for the patient's 28-day follow-up blood test. If this date falls on a practice closure day or a day the patient is unable to come in, please try and arrange these for plus or minus 2 days. Patients will also receive a patient diaries SMS to fill in until their symptoms subside, so we ask you to encourage them to engage with this element of the study. I'm now going to cut to an interview of one of our top recruiting clinicians, Dr. Ivor Singh, who has kindly agreed to share his experience of the study, how he's running it within his practice, and why your site should get involved.
We're good to go. So, Ivor, could you just kind of give us an overview of how you're running the study in your practice and what your kind of setup is for it?
Yeah, sure. So I'm Ivor. I'm a GP in Hounslow. So I have I work with an organization that runs 5 practices in Hounslow, covering a population of around 50,000 patients. We had signed up to the Raptor trial and we rolled it out in a hub model. So in one practice that I was mainly based at, doing the tests in the car park. I personally have found the Raptor trial very helpful, especially that we didn't have rapid tests in practice early on. So I found that we've been doing the tests in the car park across the practices. So basically, I think I realized early on for one, I think it's trying to make things easy when you have different components and then you've got a different computer system. So I think, and then you've got different tests that have to go to different places. You've got the Manchester lab, and then you've got the Colindale lab for the swabs. I think it made me realize that you have to be organized, and I tried my best. So I've got I can pull the drawer. I'll just show you what I've done. Tried to get things a little bit organized. So I've got like PPE in the last drawer. Some of my labels have come off, but I've got, so I tried to keep some of my packs. I've just got my swabs, by the way, today. I've got delivery of my swabs, so that's brilliant. But normally what I try to do is try to create packs with the form and the envelope for Colindale, the correct one, for each one. So if a healthcare assistant picks it up at the surgery and does a swab, then it doesn't get confused with the wrong form thing. So I was trying to create packs for the swabs, COVID antibody tests. So you have a little pack with the Manchester envelope in there and the Raptor microbiology form for Ezra in Manchester. And then the rapid tests, what I did was I got clear Ziploc bags and put them, one of everything in each bag. So then before I was putting it in the sealed envelopes, but then in the car park we were fighting to open it, and then sometimes a bit will fall out somewhere in the car park. So so I just thought Ziploc bags would probably be the easiest one, and then all the rubbish can go back into it, and we've got a yellow bin right outside the practice door at the back. So when we do the test, we pop everything back in there, take off our aprons and everything, and put it in the yellow bin along with that once we finished with the test. Mind you, we are keeping the test for 29 minutes because we did have one that popped up around 20 something minutes positive and was negative within the 15 minutes. So what we do is all our tests we've been doing from early on at 29 minutes. So we make sure that we record the time. So sometimes we do bring it in a papier-mâché tray, and we keep it on the sink behind in a specific area that we clean afterwards. And we keep it in a little plastic tray so that that can be sprayed and cleaned afterwards as well. But I just found this kind of thing helped the healthcare assistants because they just pick it, they know that that's one kit thing. Otherwise, I was finding that I was coming to the end of the box and finding I was missing some of the liquid tubes, or I was having a couple of swabs short or that kind of thing. So at least this way I know that that's one pack for each person. And then I've got some blood stuff over here in another drawer. So at least then I've got, if I need to do the antibody test, then I've got my stuff there. And then I've got some PPE at the bottom and some gloves. So what I tend to do is, a couple of ways. Some I do, like for kids, I usually do it in the car park. So if you've had a couple of, so like if one of the other practices or one of the receptionists here speak to a patient or a doctor here and they say, look, I think this patient got COVID, can you do a test on them? They come into the car park and phone the reception. They're added on my list, so then I know that they're there, or the healthcare assistant goes out and does it. So if it's a child, what they will do is they label up the PCR, the PCR swab kit. So I try to streamline things, because the thing is, if you label it up afterwards, then you possibly got a contaminated sample in your thing, and then you're playing around with the printer and everything else. So I try to, we've got some label printers, so we try to label it up before we were labeling it, doing it in the car, and then asking them to post it potentially. But then because we were having that problem with some of the results not reaching the lab, what we do is we're bringing it back in an orange bag and then transferring it to the gray bag for the courier to collect. But I think the important thing is labeling it up with labels before on the blue form. So you've done your form and then you've done your bottle. So we take the bottle, and so we do that, take that into the car park along with the rapid test. If it's an adult, we've done a couple of things. So one is we have done the blood test in the car park. Some cases we wheel the trolley to we've got a back exit. So we put a chair right outside the back exit, one that's like hard, like a plastic chair that we can clean and wipe down afterwards. And we put it outside the door. And then what we do is we wheel the trolley all the way there. We wear an apron and PPE and thing. And then we do the blood test outside, just outside the door. Sometimes it depends. If it's raining and things like that, then sometimes it's a little bit tricky. There have been a couple of occasions where they didn't get a blood test that evening, and I had to bring the patient back in the morning. Or if it was dark outside and they couldn't see properly for the blood test, but they were managed to do the swab. So sometimes I've just said, all right, look, let's just bring them back in the morning, and they come in the morning thing. So sometimes I think is being pragmatic about these things and making sure that at least if they can be as close as possible together, if we have to do that. So I think that's kind of my process. I've been, so far I found I think what puts off people sometimes in general practice is when you've got multiple things. So especially when you've got a computer system, then you've got to put someone on UMed, and then you've got to, get the sample. So what I tried to do is to try and keep UMed for myself. And I managed all of the UMed. And in some way, that's what was a slight glitch when I became unwell with COVID in December. So the problem was that and it wasn't because of a Raptor patient. It was a normal patient, just a thing. But but I found if I asked colleagues to do UMed, I was finding that they were sometimes not doing it properly, or things like that. So what I did was I said, if I'm not there, and just do it. And I did a paper format. So I did a paper form for their temperature, their oxygen levels, their pulse, when did they start, just a kind of little questionnaire. So at least then they can do that. with the patient on the phone before they actually book the test in, so they don't bring that paper back into the building and put it on my table. So, you know, it's just working through. So I think it's, in general practice, we're not used to being sterile, I think, all the time. So I think it's one of those things that we just had to figure out just a couple of steps. But as I was mentioning earlier, I do feel that the Raptor trial is actually low risk compared to a patient in the room for half an hour with you face to face with for something else medically. So I haven't, none of our colleagues have had any sort of COVID related to any of the Raptor patients. So I'm quite comfortable. I have picked up quite a few patients with who potentially, I picked up some school children potentially who would have gone to school if it wasn't for that rapid test. I picked up some, there were a couple of staff members who have been registered to one of our practices. So I've been able to kind of bring them in and do that. There have been some patients quite recently as well. The only thing that I find which has really helped, the courier's really helped, because I know that we can get at least, even if it's 3 or 4 days for the PCR result, but at least it is 3 or 4 days. The only before we had a little bit of a glitch where we had to wait a bit longer for results, and there was some question about whether the lab received it or not and things like that. But I think now that has been solved. Thank you for solving that. So far, I have found the rapid test actually really good. The only caveat from my side, again, that's why the whole study is for, but I think it has really been really helpful in reducing possible transmission from patients who might be positive. So yes, sorry, I know you asked me just for my processes and not my views, but apologies. Thank you.
No, that's absolutely brilliant. Thank you so much.
No.
Our other question is just about recruitment. How are you, you've done absolutely incredibly. You guys are our top sampler for Raptor. So how are you keeping that up? How are you finding the patients and bringing them in and consenting them, etc.?
I think in the beginning, I think looking back, I think there were a lot of worried wells, patients who have come into contact and they had, or they felt they had mild symptoms, where looking back now, I can see some of their PCRs were negative. Again, I think it varies, but from our side, so if I was speaking to any patient with possible COVID symptoms, I was telling them to come in, and 2 of our other practices are also, so out of the 5, I think 3 of them are quite research active practices. And I was getting referrals from Heart of Hounslow, and also, which is one of our other practices, and also Heston. So the 3 practices, because I work at all 3, so I kind of know them quite well. So normally what they would do is they would send me a message and say, look, I've got a patient, can I send them to you? And then we were, they were coming in the car park. What I've done is I did mention UMed. So UMed, I've tried to keep as much, take away as much paperwork or having to do the computers, because our healthcare assistants also help with reception and other things as well. And sometimes I was finding that there was, it was causing them a bit of stress. So what I've done is I've left, so if they get a patient, then they can do the rapid test in the car park, they can do the PCR in the car park, they can do the antibody level. But if they do the antibody level, what they're doing is they're putting it in an orange bag and leaving it for me, and I'm doing the UMed along with the the UMed ID for Ezra because the UMed ID is needed before him. So I sent a couple of samples to Manchester without the ID. So apologies in between, but it was not a lot. It was probably 2 or 3 samples. But at the moment, what we're doing is we're making sure, or ideally I register the patient and I tell the healthcare assistant, look, this is the ID for the patient. I do the form and then she can do it. So I think it depends, but I've got two healthcare assistants who are trained up so, to help me and myself, and so far it's been working quite well. I've been doing, so I think we've done around, I think it's around 80 so far. I think a few of them might have slipped the net, where we've had a couple of patients who were tested when I was away, and I've been given some paperwork now, but I'm just trying to make sure that make sure that the PCR has been done and everything before I put them on UMed, because I want to make sure that they have a complete set and we don't give any sort of part data to your team. So, but yes, so I think you need a clinician involvement definitely, just to kind of oversee it and just to make sure that things are running properly, that the drawers are being stocked, that kind of thing. Even if you allocate someone to do it, but at least if you know that that's happening. And UMed, I think, Abby, you've been amazing with UMed. Thank you.
Great. And I guess kind of the last question we have is, I know some practices are interested in taking part in Raptor, but are concerned about, the time it takes and the resource and, it taking away from the other responsibilities that the practices have. How have you found balancing Raptor with all the other patients that are coming through the practice?
I think actually it's worked very positively, because we've had patients who we've been able to kind of risk assess them as well. So we've had a few patients who one of my colleagues next in one of the other rooms in our surgery would have spoken to this morning on the phone and said, actually, look, I think I'd like to see them, but I'm a little bit worried that, they've had a cough for a couple of weeks now. I don't know, do you think they may have COVID or not? Mind you, for that, we wouldn't do it because it's the days. There had to be 7 days of symptoms, but I may not be 2 weeks, but if they have a slight cough, and the problem is our COVID hub, where we can refer patients at the moment, are being very stringent on who they see and who they don't see. So if they don't have good full-blown COVID symptoms, they'll probably reject the patient and ask the GP to see them. So things like that, we can actually risk assess them in the car park, at least by doing the rapid test, send off the PCR, but at least you kind of it's a bit better than just going in blind and bringing a patient into the room. So we've had a couple of patients where we've actually tested them in the car park and turned out to be positive. And at least that way we don't bring them in to the practice to see the doctor or to come for a blood test or whatever for your normal, follow-up or blood pressure check and things like that. So I think it actually helps you to risk assess in general practice as well.
Brilliant. And roughly from start to finish, how long would you say it takes to see one patient for Raptor?
I think I have got better. So I think right in the beginning, it used to take me a little bit longer. I think after the first 10 patients, I think once you do it a few times, it becomes automatic. Like on UMed, you got the little quirks with the plus and then the 44, and then you got your number, or you put the month, date, and year or whatever. But I think once you do it a few times, then you kind of know that what data you need. So even if I'm in the car park, for example, where I might test someone in the car park, I might just ask them on the phone before I bring them in, or sometimes even when I do the test, they're in their car with, the windows are a little bit open, but I've got my PP. Sometimes I might just say, with their mask on, I'll just tell them, no, you've had symptoms for 5 days, you told me on the phone. That's that kind of thing. So I just kind of know what questions I need, and then at least I can fill in the data. So coming back to time, so I think if I was again with the whole Raptor thing, it's been ad hoc. So I think setting up clinics for Raptor is probably not an ideal thing. I think having some flexibility with some nurses or healthcare assistants trained up and yourself, and knowing that potentially you might just get a patient ad hoc saying, they need a test in the car park. So for UMed, I would say probably around 5, maybe 3 minutes to register them, probably. I would say just on the UMed platform. Consent, I usually go to the questions of consent and I tell them, as part of research. Like I kind of know the questions now already, so I kind of go through it on the phone. So sometimes I might not even put the answer there and then, but I know I've already gone through it, all of the questions, and I then do the UMed. So I would say probably maybe 10 minutes for the UMed, maybe. For the actual testing, it depends. If it's a child, then it's pretty quicker because it's the nose and rapid test. If it's a blood test, maybe around, by the time you put on PP, take off PP, maybe around 20 minutes, 20 minutes, 25 minutes, maybe. But on balance, I think I've been able to offer a service, a bit more of a service potentially, where if someone went to a drive-through and had to wait 3 days for a result, potentially that might I don't know. I think it just adds to that the processes, I think, or options in the practice.
Great, thank you. Okay, so I've got one kind of final thing, and then I'll pass over to Abby, who's been patiently, quietly in the corner. Sorry, Abby. What would you say, just like quick, like 1 or 2 sentence quote to practices that are on the fence about starting Raptor?
I would definitely say that they should definitely go ahead and sign up, because I think one, they'll have access to sorry, my screen's just turned off, sorry. So so basically I have one, you'll have access to rapid testing for your patients in primary care in your practice. So some practices, so I know over Christmas a couple of staff were a bit naughty and they used a few of the rapid tests, and I did advise you on that. But at the moment now, practices are being sent their own rapid test to use, which is a blessing. But the biggest thing is that the fact that you've got rapid testing for your patients in your practice, and I think that is to help protect the patient, yourself, your staff potentially. Plus also, you know, there is some financial remuneration as well. So, you know, if you factor in things, you can say, actually, look, you know, I've got a healthcare assistant, maybe I can train them up potentially, who'll be able to do maybe 2 or 3 tests per day, potentially. I think it's a win-win really, because one, you've got access to testing that patients hear about lateral flow testing even more now in things like the news. There's schools doing lateral flow testing. But I think if you've got a patient that you're not sure, is this could this be just a normal chest infection? Could this be COVID? So again, it just helps you risk assess. So sorry, I know you asked for one-line quotes and I'm giving you a long spiel, but I think definitely, I would encourage as many practices to sign up to it, because I do feel it will help their capacity to help their patients and themselves.
So there you have it. As always, if you have any questions that haven't been answered by this video, please send them to raptor@phc.ox.ac.uk and the team will be on hand to support you. You can also find further information on all the aspects covered in today's video on our Information for Clinicians website. We look forward to working with you over the coming months, and thank you for all your support on the study on behalf of the entire Raptor team.